David Kindig.
Sure. Well, actually, kind of building on what you said, so I agree with everything. My mind is full, as it often is after these roundtable sessions, and how do we put it all together into action is a challenge. So the immediate thing that occurred, and when you were talking about community versus national level, so actually people not on the roundtable or on the web also probably don't know that we also have some internal subcommittees working on different aspects of our work, like relationships and resources. And Tom and I chair a subcommittee on metrics, which is me tomorrow morning, so that's kind of in my mind, and we don't have that figured out. And our job in that group is to kind of figure out some kind of metrics or benchmarks or goals that would help motivate our work and work in communities, and we're still struggling with that. But I was going back to last night's session with the students, and when the rotten cheese sandwich, was such a motivating, I mean, they just kind of jumped out of their chairs when they said, what do you need fixed in your schools? And, it was this bad food. And, instantly, people were sort of onto it. And sort of just was making me, we often think in terms of fancy epidemiology and those kinds of quantitative goals, and we do need to think about that. But whether there's some images or some narratives or metaphors, like that cheese sandwich that would appeal, and whether we should subdivide that into youth, or there was other conversation today about some end-of-life issues and dignity, and whether there's parts of population health improvement stories that we could somehow develop that would be motivating. So that was, again, a question left in my mind, but stimulated by today.
Excellent.
By the way, David, I have the rotten cheese sandwich. I took a picture off the young gentleman's phone that we can tweet this maybe. So, so for me, I agree, George. There's a lot to think about today. It seems to me that as we think about a way to approach this work differently, that we have to back way up to where the sources of money are coming from to support the work, whether it's from government, whether it's from philanthropy, whether the sources that academia seeks out for funding. That oftentimes the deliverables and the lanes of funding and the categorical nature of dollars prevents the organic discussion at the community level about what the priorities should be. It's in the wrong order. We walk in with a finite group of possibilities that are all in a very, very specific sector often, and that's wrong, and that the funders writ large could do well to direct more meaningfully the importance of incorporating the community organizing component into the work as an essential piece of what we do. And so I think there may be things that we can do as a roundtable to think about those order of operations and how we can more meaningfully, from a scale standpoint, begin to promote this sort of meaningful and lasting work that we hear that will have profound implications beyond just the public health sector. Building leaders, as we saw last night, that I think are very profound. So that's what I learned, and one of the things I learned anyway. And so if you want to see the cheese sandwich, I'll show it to you at the break here. So
Thank you.
So once again, I just would like to share our gratitude for being here and listening and being able to be a part of this conversation on a larger scale with all of you, everyone that's here. And because of that, I feel like what I really learned is that, again, the saturation, we're having the same conversation. And that says so much. Maybe we're further along than we thought. And that really continuing to make those connections by, leaving our offices and going out into the streets, and us that are out in the streets having more conversation with people and other institutions, and finding ways to connect and being intentional and really making an effort. Seems like we're already all here, so how can we just continue that? So that feels really good and actually kind of exciting and more hopeful. And at the same time, we represent a small community, and so, I just want to state that at the same time we, request and know that you all are tasked with representing us in places where, to switch those paradigms and to do things differently, it may take some work, and it may take some courage, and it may take some risk-taking. And so, in advance, we thank you for doing that, because, as many people have said, it's all of our lives. It's someone we know. It's all of our people. And I have one more idea. What we could do to start that would be at the very end, take an Institute of Medicine selfie. Why not? Obama's doing it. So you can think about that, but it could be fun. All right, thanks.
All right, there's a suggestion. Other reflections on what we've learned so far today?
So I'm trying to figure out the message that we got from the communications subgroup, which met a couple of weeks ago in Washington, where we had communication experts come and talk to us. And I'm wondering, their message to us, what I took from them was, you are the IOM. You have a special place in the world. You have authority. You have scientific authority. Don't stray too far from what you know how to do and what the world gives you recognition for. And then we hear a day like this, which really appeals to me in a whole different way. And I think it's a real struggle. And I would hope that, in a way, that some of the people who've come to visit with us today could speak to that a little bit, of how their view of what the IOM could do could be useful in service to community organization. I feel like we're sort of too far away, but maybe there are some tools that we can do that help us bridge that. And for those of us who sit here, I was sort of saying in the break, not really getting much dirt under our nails, and sort of longing to sort of feel more immediately relevant, what are the things that we can do as an IOM roundtable?
So I think one thing I'd offer a perspective on that a little bit. One is our charge that we've laid out for ourselves is so broad. I mean, it's so broad that it includes this work. And it's up to us to figure out how and how to make it relevant. It's not just, the dry statistics, the science, but it's the doing as well. And if the communications people are saying, stick to what you know best, well, this is what we have to learn how to know best, in my opinion. So I think there's a challenge there. But that's only one point of view. Debate me if you wish. Please.
So first off, I would like to say thank you for having me. All the acknowledgement I received after me speaking, I could tell that you guys really care about the youth voice, and I think it'd be very beneficial to have more youth come and speak and receive this kind of experience for future generations and later become what you guys are today as a roundtable. So thank you.
Well, thank you. And I must say that we have learned a lot from the youth voice over the last day and a half, and really appreciate that input and the suggestions. You have taught us by your example and your enthusiasm and your energy, so thank you very much for that. Please.
Well, in response to your question about what the IOM Population Health Roundtable might do, you've heard the word narrative used over and over and over again. And as you write the synopsis of this session, how you say what you say will be critical. You have the position, the power, the platform to shift the discourse. I mean, just as we have finally moved from talking exhaustively about health disparities and now talking about health equities, you have that same club of power to force us to think differently about this issue based on how you intellectually explain it. And so I would just challenge you to think deeply about what would be different in this synopsis than perhaps others.
Do you have some suggestions for us, Renee?
She said, would you write it? I mean, yeah, there are some. The subtleties of words are very powerful at this developmental stage in the dialogue. So I'm happy to help you, however.
We will have a group. We have a couple of vehicles for voices on this. The summary of this workshop will be prepared by a group that will be appointed by the IOM, and it'll be written up and reviewed and follow the IOM processes. But we have a opportunity to offer commentaries on this, what's happened today, or any of our work. And I would invite those voices to participate in the dialogue and to point out these things. Alina is our contact for that, right? And so this is not just, this doesn't have to be just one unifocal voice. In fact, one of our purposes as a roundtable is to promote dialogue. Mm-hmm. Dialogue meaning listening and exchanging views. So I just want to take the opportunity to point that out and invite any of you who may want to join, particularly of those who have been here and participating in the workshop. This is the opportunity for you to show us some of that, or for others, in terms of what you write. So that, thank you for making that comment, allowing me to say that. Please.
So Renee stole a bit of my thunder, so I'm glad I'm coming right after her. And I will say on the record, I know we're recording, that if you do agree to that assignment, I will help you out with writing that commentary. because I think that's one of the things that really resonated with me, that last panel, that we talk about university-community partnerships, and there's actually quite a lot published on the topic. So there is, work that's out there, and I think it would be something that we, as a roundtable, should take on to kind of pull some of that together and write something about community-university partnerships. And I think the key is that they do have to be partnerships. I mean, that was one of the points that I was just making with the group before this session started up, which is that when we talk about that, often the narrative is the university people have to change and cede control of the project to the community. But, that doesn't sound to me like partnership either. I mean, if it's partnership, we are partners. We are a team, and both the university people and the community people have agency and bring something equal and powerful and important to the table. And the community people also have to change, because they have to understand the incentive structure that the university people are operating under. And the publisher parish, the reality is that when I was an assistant professor trying to make it through that process, and I see you're nodding here, the reality is that as someone who is motivated to work with community people, that if I don't produce those widgets and put them in the journal, I won't be here next year to be able to continue to be your partner. So we both have to understand that we have needs and interests. And the other comment I wanted to make is about the private sector, which is a part of the community that hasn't really been talked about a lot. But the private sector offers great potential, I think, here, if we can begin to craft our narrative around the interests of the private sector. The private sector has the ability to control resources, to bring resources, and not only financial resources, but also personnel, and they are a part of the community. And most corporations want to be positive corporate citizens. So I think bringing the corporate sector in, finding ways to get them to interact with communities is key. And I also think the profit motive is a powerful motive. And if we can only get the force of capitalism to work for the community good and find, and I think that's a tricky notion, but it's something that I think we really need to start lending some real intellectual energy to. How do we craft interest or create a narrative that brings the economic incentive that would lead to community good? So I'll stop there.
Yeah, thank you very much. And I'm thinking that I'm not doing my job by reminding people to identify themselves as they come to the microphone.
Yeah.
And one thing before we go to you is, the other thing that would be kind of nice to see is a commentary on some of these issues from some of the young voices we've heard from.
Yeah.
Just as an idea or a thought. And I'm sure that we can figure out a way to do that. Please.
Good afternoon. My name is Eva McGee, and I'm on the faculty at UCSF. And I apologize for not getting here earlier, but I just left a really fascinating meeting in San Diego, and that's why I'm here to give a voice. Basically, I just left the AACR, the American Association for Cancer Researchers, which is about 20,000 folks that got together. And so the president panel on vaccination and HPV, the human papillomavirus, I actually got invited to that, and I went to that. And the report that I heard, or what is going on, is really kind of devastating when it comes to the vaccine. So what's really devastating is basically in the state of Mississippi, only 12% of the girls are getting the vaccine. Now that's devastating because, as you know, HPV, it's preventable when it comes to the cancers that are associated with HPV, like cervical cancer or anal cancer and their oral cancer now. But if we do not somehow educate the community and educate the physicians and so forth and so on, we're going to be seeing a new wave of cancers associated with the human papillomavirus. So these diseases are they are preventable. I mean, you can't treat them. And to end this, I will say that for our generation, we probably can't prevent anything, but for the next generation, if we educate these people about the vaccine, we can prevent an array of cancers. Thank you.
Thank you for that comment. The thing you raise in the context of the day's discussion is again, those things that are important to the health of the community that we know from science and research, which are not necessarily those things that the community would necessarily prioritize at the top of their list, because there are, in many communities, other important needs, many examples of which we've heard over the course of today. And the challenge that you're raising, which also came up in the discussion at the last break, actually, one of the conversations I was in, is how does that work between those things that need to be done across all communities to promote health, and where does that, how does that work with respect to how people feel about that at any given point in time? There are other issues like immunizations and that are in that same category these days. So we didn't really have that emphasis during the course of the day, but there are conflicts where the community and public health sort of meet in a sense, and there's a challenge there to be figured out. I really appreciate that comment. Phyllis?
Yeah, I'll be really brief. Just a couple of reflections, and one is, I feel like I'm getting old because the conversation about the importance of connecting with community, it's not a new conversation. It's coming back again. And so I think some of the comments that were made before I stood here are so important because I had a friend that said, Phyllis, you say that, oh yeah, we've done that before, we've done that before. And so what I'd like us to think about is this next iteration, what do we do differently to move the needle beyond where we moved it 20 years ago? And I don't have the answer to it because I'm one of these people, I have to think about it once I get on the plane and wake up Sunday morning having coffee, and then I'll say, aha, and I promise I'll get back with you. The second thing is just the whole notion of, our round table. It's about population health improvement. And the couple things really stood out to me today, and that's the relational aspect of population health improvement. And that was emphasized over and over again. And then the idea, and I couldn't find the right word other than immolation, and I know people don't use that very often, but there's a sacrifice, there's a giving in this population health improvement from those sectors that are working together. And I heard that very strongly, that it's a lot of giving in this, and there's some giving up in this process. And then one thing that I will say that we used to talk about 20 years ago that we're now not saying so much, and it was kind of refreshing not to hear people talk about empowering the community, but listening to the folks from communities talk about the power that is in communities. And because I always thought that empowerment notion was so paternalistic, like we can give you something. And communities are powerful. They do have expertise. They do have knowledge. And I think that for me is something that I think we really do have to reemphasize. And it's not this, we go in and we save you and we help fix you. But it's working with you, bringing our power with your power to equal, hopefully, more power to change some of the conditions in health. That's it.
Thank you, Phyllis. And if you're feeling old, Phyllis, I'm feeling positively ancient. So, your points about power, one of the things that's kind of occurred to me over the course of the day is, well, what is the nature of the change in power that we've been talking about? Who gets more of it? Who has less of it? How is it balanced? And at what levels? How does that work? That's a question that's come up for me. And I know we had some answers offered to that over several of the conversations we've had over the course of the day, but I'm wondering about that.
I keep coming back to the idea of what should the IOM roundtable do? How can it serve up and support the people who want to do this work and are energized to do this work? I think you're right. We can't empower them. Nor can we lead them. But the roundtable can, with its website, with its publications, be a resource to them, to give integrity to the data that they need. The maps that Pastor presented us today were incredibly powerful. And you can imagine how powerful they were, both to the groups that presented it, to themselves, to the movement, and to those people who had to make decisions to give up some power and give up some resources. And I think that the roundtable can actually, in supporting population health, even simply demonstrating the disparities in health and health access, but also the built environment, the other risks, that can be one of the things we do. And as we think about our drivers and we think about measurements, the measurements that we can serve up to support the people who would do this work would be very powerful. A second idea that I have that I think we've heard a few times today is to inform and advise those who would give grants and create grant opportunities to go beyond engaging the community, but instead design the grants in ways that academics can work with community organizers, first to find out what they're interested in, secondly to find the methods that they'd find acceptable and the outcomes to demonstrate. And you can't do that with the typical way an R01 is written. Now, PCORI and ARC have done some work with some mini grants that would help move you in there, but even as I read the language of PCORI's last offerings, it's more to help train the academic rather than engage a community realistically. And this group could advise those who would give grants in terms of that. I think that the third thing that we've heard and we know in our hearts to be true, these stories we heard today really matter. They capture our attention, our imagination. They cause us to dream. we should be publishing these stories. These stories, not our commentary on the stories, but in an accessible way, on our website perhaps, that will inspire other community organizations to say, look what was done here in LA, look what was done in New Orleans with the Rethinkers, look what was done, et cetera, et cetera. These stories are so inspiring, and yet there is no one else who's going to collect them in terms of improving population health. That could be the IOM Roundtable's job.
Excellent suggestions. And I hear a lot of your comments about research and its relationship, the research enterprise and its relationship to this topic from the perspective of this conversation. It seems like there's a call for more of a lead-in loop, a listening loop that doesn't exist today. Is that as fair? And I,
part of the funding
yep.
that first you go out there and listen, and that should be funded so you can do it, and then you can come back and write a grant then based on it.
Yeah, so that, that's calling for pretty fundamental change in the way the research enterprise works relative to these issues. So anyway, come to the microphone. Go ahead, Pamela. Please come to the microphone if you want to say, come on.
She wanted to talk on this point.
Oh, come on and talk on this point, but you got to talk to the microphone.
Yes, the R1s are not, traditionally made for community collaborations. But there are grants like the U54s, for example, under the Cancer Center collaborations. Here in Los Angeles, they have a really great community collaboration, one of that I know of, Charles Drew and the community. And they have this U54 grant, which basically implores probably about at least 20 members from the community to work on this grant in the research area. So you could actually potentially look at the U grants and some of the program grants. Yeah.
We're going to need to remember this exchange when we explore in a little more detail our driver on evidence and research. And so remember, we have 6 drivers that we've identified as areas of emphasis for us to work on going forward. They include metrics, policy, relationships, evidence, resources, and communication. And in that evidence driver is the research that's necessary to deliver approaches. But I think we're going to need to remember this part of this exchange and this workshop when we take that issue on. Pamela?
Hi, it's Pamela Russo, member of the Roundtable. This was a very thought-provoking day. And so some things stuck with me, like the ecosystem notion, the networks notion, the notion that you wouldn't necessarily take one community organization and take it to scale or move it out because it was so contextualized, and yet you could have a network of shared experience and shared exchanges. But that sounds, as the Roundtable has moved through our workshops, we've identified and highlighted communities in change. Now, some of those communities in change had to do with social impact bonds, or they had to do with partnerships between hospital systems and other partners, or they had to do with health and all policy cross-sector stuff. So today we highlighted sort of the power of community-based community change. And I think what resonates for me, and it again relates to Manuel Pastora's maps and something that he said, that if you look at the communities in which this necessity to try to bring some justice and some fairness, communities that are very disenfranchised, that have been systematically, as he described it, it's not a random thing, right? It didn't just randomly evolve that the schools weren't being built in East Los Angeles, and the toxic screens that he showed, led us to a series of communities in which, it's a perfect sort of environmental justice concept. And so I think the question for us as a roundtable, if we're really trying to create, this sort of notion of a movement across, is how are we going to balance and integrate and think about how all of these things work together in a sort of a greater ecosystem. We've been, I think, appealing to we've been hearing from a different kind of audience previously than we heard about from today. And I think the other gulf that bothers me, I mean, I've worked a lot with public health departments over the last 10 years, and there are a lot of really highly innovative health departments. I mean, Renee didn't tell you. I mean, Ingham County is one of those health departments that we hold up, like Cuyahoga County and L.A., you know, where there's a tremendous amount of work going on to improve community conditions, policy system, and environmental, and interactions with communities. And as Renee put it, they're not organizing the community, but they are providing coalitions and support. And I think there's a gulf. I think that a lot of community organizations don't perceive what they might be able to get from a health department. Not all health departments are there, but they probably the context and the visibility of that relationship isn't what it should be.
Yeah, very, very important comment. That ecosystem is bothering me too in terms of wanting to know more about that, figuring that out. Thank you for that. Kathy? I see you've moved to the head of the line there.
Thanks. Kathy Bazzi from Dow Chemical. You know, I was thinking about today's workshop and all of the deep meaning from that in the context of the series of workshops that we've had, the whole package of them. And Pamela, very similar to your comment. And every time we have one of these workshops, we seem to come to the end of the day talking about how the collective knowledge of that workshop was so critically important. And then we get to the next one, and that's critically important. And then we get to the next one, and that's vital. And the reality is that I think that it's all true. You know, it reminds me of the comment of the World Economic Forum that the challenge that we're facing here is of such complexity and magnitude that the only solution is the mobilization of all these social forces. So it's not, you know, the academics and the public health groups or just the power of youth or the power of, it's the great wisdom and the great contribution that I think is out there to be discovered is how to really effectively do that mobilization of all the social forces and how to do it at scale. We always are asking about scale. And there seems to be no singular path to that scale, just as there's no singular sector that if only we could, you know, get a completely renovated workforce inspired in the public health world, would we have all the answer? No, I think we realize, and we need the power, you know, somebody said the power of capitalism. We need to have the business community. And I think that's the collective message that we're discovering on this journey is the importance of bringing it together. And the scale question is that there has to be sufficient insight on the power of this possibility coming from all sectors, and that there needs to be able to be this continuing facilitation of leadership. Because what we witness in all the stories that we see, and again, another advocacy for the stories, is that the stories are coming from all the different sectors. In one community, the story was stimulated and centered based upon a leader in one sector. In the next community, it's in a different sector. So I think they're all valuable, and I don't have the answer, but I think scale is going to require all the sectors, and it's going to require that sort of inspired leadership in any and all sectors because, again, the magnitude of the problem is so overwhelming that we're challenged with that we have to figure out how to get the mobilization of all social forces together in all sectors. So, thanks.
Thank you. So we need to be thinking about where those key leverage points are. We need to be thinking about how we engage people beyond the roundtable. We need to be thinking about how we use the tool that we have, which is influence. So,
Actually, just building on that, Dave Kindig, one of the things I wrote down when Kate from PICO, I don't know if she's still here, she had to leave, okay. When she actually did her very brief introduction to that panel, she said something, we struggle with these multiple determinants of health, particularly the social determinants. And our whole list that George read off again, it's these interrelationships between income and education and healthcare and public health, and figuring out what's the right balance, or which one comes first, or where should the next dollar go. And of course, it varies from place to place because different communities have different needs. But when she said, that it's so complicated like that, and it may be really hard to figure it out, that actually the empowering of communities to sort of work for and advocate for their own, the way they see it themselves in terms of that balance might be a more effective way to sort of build it that way. And I don't know why that seems so clear. I don't know why it struck me as profound, but I did. And I actually asked her to write a commentary for us on it, and I think she will. So,
thank you. George? Oh, no? Anybody else with reflections, comments on the day? I think one of the other things that has struck me is the comment around policy, in other words, what to do, and capacity. That came out early in the day, and so I'm just wondering about that capacity, the capacity for change at a community. What needs to be developed? How does that develop? How can it be fostered, helped, encouraged? And then there's a capacity for I guess what was called organizing in the course of today. And I think the organizing was around, I think one speaker talked about labor unions organizing as a story about organizing. But how do you organize those communities where there's that need around any issue, and the lack of existing activity? What entity or what effort or what resource needs to be engaged for the capacity to scale where it's needed, where it's not occurring currently? How does that happen? Is that public health? Is that not public health? How does that happen? So I'm left with that sort of question. Please.
I've been wanting to come up to say this, George, and I think that I don't have an answer for you, but your comment helped me kind of put words to what I was trying to think about, and it was triggered by Jim's thoughtful remark on the war versus the battle. And something that keeps coming up, and Manuel Pastore started off with this, which is vision, right? When Martin Luther King fought for the civil rights, it wasn't an issue. There was a vision behind this. And I think about the communities that we all work with, and even yesterday hearing the youth, there's a vision, right, behind what's driving them to want to change. And I think about the whole concept of health. Well, health for what, right? If we can't have hope and dignity as part of the future of the lives of the people whose health we want to improve, then what's the point of even that battle? That's still even a smaller battle in the context of poverty and of these other larger inequities. And in thinking about what Jim said about the battle versus the war, I think back to the American Revolution, right? It was in the South that the battle was being fought to hold back Cornwallis's troops. But it was in the North where George Washington was really supposedly fighting this war. But without the battles in the South and Virginia and North Carolina, some of which were lost, there would have never been a united front to fight this American Revolution, right? And then we think about even that. So we had the Declaration of Independence, but it wasn't centuries later that we had the civil rights movement, where we truly achieved this vision of equality for our country. And I mean, Phyllis says she feels old. I, as young as I look, feel really old because I was a director director of Community Voices in the 90s in New York City, and the very same topics that we talked about then are being talked about today. But I realized that the importance of the battle is that these communities are still finding their voice collectively, right? That in empowering generations to fight this larger war, there's still, there's capital, right? There's human and social capital for fighting for something that generations to come care about, which is dignity, respect, hope, a future. And so I'm not very organized in what I'm trying to say, but it's that vision that matters, where people can organize behind, whether it's public health, whether it's housing, whether it's, you name the sector or the issue, but without the vision, there is no movement, right? So that's just stayed with me with Manuel's, even his illustrations today, that it's that bigger, larger context of that topic that really matters. I think we lose sight of that.
So just a moment, though. So are you posing the question of, is health the right endpoint? Is it health for...
Not the endpoint.
Yep, right.
Yeah.
I got that.
Yeah.
But I just wanted to get you clear about that.
Yeah.
And then it's health to enable what?
Yes.
Health to enable...
Well, I'm leaving that blank, because I'm saying that what really matters to community is a future with hope and dignity, is what I'm saying, right? And that's universal. That doesn't matter what level of income you come from or what communities you come from. And I'm saying in this fight for health, and I think about hospitals and healthcare sectors that have been built to improve health, but they've lost sight that without people owning that for a purpose, then there's no point. We lose sight of that. So I don't have an answer to the end what, but I'm saying that we can't forget that health is not the end outcome here. And if we lose that in our vision, then we'll lose sight of what we're trying to fight for.
It's a great point of view, great comment. I don't know if everybody agrees with it, but you know, it raises kind of an issue, you know. And to add to your comment a little bit, I've often wondered myself whether health is one of a number of things well, health for what? Health, you know, maybe we need to have a bit more of that conversation in terms of the relationship to the other key outcomes, social outcomes, and other outcomes that matter in order to figure out the narrative that we've heard so much about today, and in order to tell the stories that are motivating. You know, maybe we need to work on that. I don't know. That's my own comment. Go ahead.
So Corinne Graffunder again, it did inspire me to say something I was thinking about earlier, which is back to even just data, right? And so I guess it makes me think of two things. One is that we've heard an awful lot about other movements that have many shared ultimate longer-term interests, like the environmental justice movement, like, you know, education reform, restorative justice. I mean, we've heard a lot of different movements. So I think as this body thinks about data, I would encourage us to think about where those conversations, that dialogue has already occurred or is occurring, and what are the important metrics that have already been identified, so that we're not making it up or starting new or creating a new language that didn't need to be created because there's already a language that's being used. So I think there's a whole data piece there. And that last comment made me think that also in using data and metrics to define your ultimate outcome and to measure whether or not you're there, there may need to be some consideration given to what are sources of data that allow us to think beyond the, you know, even just the common health-related metrics, but also the more common social determinants of health metrics. So, you know, graduation rates or, you know, income. I mean, there may be things around hope or, I mean, the Search Institute, are you all familiar with the Search Institute? And so they have work that they've done more with youth again, but youth as these markers of whether youth feel that they are on a trajectory to succeed. And I believe it's very validated. It's been shown to, so that may also be a source to consider when thinking about how we think about data.
The other thing your comment stimulates for me is data is, you know, kind of taken had an emphasis today. So I think we've heard, not that data is not important, data is important, but I think we've heard people say, keep your eye on important balls that are data plus narrative. Data plus values. In fact, values more important in change than data. Data probably more important in knowing what to change, but values being critical. So thank you for that comment. Please.
Hi, Ellen Sanchez with Avanza Healthcare Strategies. I wanted to respond to the last question you posed about, is health it? Is that the end goal that we're really looking for? And I would say that it is, because, and I think part of the reason that we talk about, you know, all the social determinants affecting health and part of the reason that cheese sandwich is so offensive, right, is that it's very, very personal. I mean, it's not only something that is our community, but it is our own personal lives. You know how people say if you don't have your health, you have nothing. Well, not being able to have control over your health because of all the lack of control in all these other factors in your community strips people of their dignity. And I think that's why people of all ages, including the youth, can get so impassioned to do this work. And I think that's why when they do have successes in this area, it sparks such strength that goes in so many directions. So I think that I just want to add that I think that that the IOM can have a real impact by just putting your influence behind the importance of the things that you have heard in the last couple days about community organizing and really having the anchor institutions in communities that do hold so much power and so much of the money, needing to work and needing to listen to communities and partner with community organizing and the youth out in front. It can have a huge impact.
Thank you very much. George, are you now ready to? Did we bring you up?
And as it turns out, it's almost a ditto, but no. I think what we heard today could be termed in today's political parlance as a progressive agenda. In fact, most of who spoke from the community were clearly speaking from what some people might consider a very social movement, socialist point of view. Yet the systems that we're talking about, and Ellen just pointed out, that have the power are certainly paragons of capitalism, and so one has to wonder, can an agenda for progressive change and improvement in community health actually occur in a capitalist society where the agenda, the agendas may not mesh? And in order to come together, it maybe does become the responsibility of an entity like the Population Health Roundtable or the Institute of Medicine to find the language that will bridge the interests of those who are in positions of power and hold the economic fate of our country in their hands, and those that are looking to get a leg up and move up in society and have communities improve. So what that language might look like and what that convincing argument looks like, I think, is there. But I think that the way to translate that so that it resonates with both sides and tells an honest story, but gets the point across so that we can understand each other's agendas and then find the ability to work with each other so that we can move toward improvement. It's kind of like finding that common ground because, well, you guys are mostly from Washington. What I hear from California is all about this this fight, and it seems to maybe population health is caught right between that agenda.
Thanks, George. David? And then we're going to take one more comment, and then we'll be...
So I wasn't going to build on that comment, but actually I will, because I feel really strongly that we have to find that common ground. And this is not just going to be, we're not going to change the colors of these maps with just liberal or socialist policies. It's not going to work in our country. And there are lots of rays of hope. And I'll just repeat the study that I've talked to some of you about that came out last fall with some of our scholars, where if you ask in opinion surveys, should the government be involved in programs to combat the obesity epidemic, liberals say yes and conservatives say no. I mean, in general. But if you add the term, if you add into the survey, if you say, should the government be involved in programs to combat the obesity epidemic in order to enhance military readiness, you know, the conservative needle goes all the way almost to the liberal side for support for government programs. I talked about this at a seminar in Harvard, and somebody said, well, that's a trick. You know, well, no, it's not a trick. It's an understanding other values that you have to tie into. So that wasn't what I stood up here to say, but thank you. I believe it is a challenge. It is a challenge for us to find that common ground. The reason I stood up was just a little note on this narrative issue. Remember Francesca Paletta, who keynoted our December workshop? So she has a book, which I've now read, called It Was Like a Fever, and she's actually a student of what works and doesn't work in narratives, you know, for social movements. Has some dense aspects to it, but it's a lot of, if you're interested, I found it really interesting reading, and I'm thinking about it a lot.
You know, we heard an example of something that's related to this either this morning or yesterday at the site visit, and I can't remember which now. So forgive me if I've got it wrong, but the students, when they decided that they needed to go to the city council, the group bought them polo shirts. Remember that? So that they would present themselves in a way that began to bridge the communication gap right from the appearance. And so we do that with language and framing as well if we're committed to achieving our objectives. You're bringing home. We got two more? George, are you going to make a comment? No. Okay. Robert?
I just
Say
want
who
to
you
follow
are.
Up on that. Health is not the ends of humans' existence. It's not their goal, but it certainly is a means to get there. And if we view health as a right, and we understand clean air, clean water, safe streets, healthcare access as those things that enable that, and we see the work of the Population Health Roundtable as focusing on securing those means, then I think we're all in agreement, at least at that point. But the problem is we have to get to a point where we demand that health is a right. And you and I talked about that. I think without articulating that, just allowing our environment to be developed for corporate means, for money making, with lack of consideration of safety of the streets, lack of consideration of safety of the water and the air, lack of focus on making sure that everyone has access, we're fooling ourselves. And we, as much as I hope it's not liberal ideology, it seems like today it is, but we must demand that health is a right, as a means to get what any individual could articulate as their own destiny.
All right, thank you very much. Do we have comments from the public, from the web? Looking at, have we had any emails or comments from our listeners on the web that we want to ask questions about? Checking. Okay. So we do have a comment or two, so stand by here. And then after we take those from the web, I am going to ask any of the member of the public who is here if they want to approach the microphone and make a comment before we close. So if you're thinking that you might want to say something, this is the time to get your thoughts together. They're checking the computers. For those of you on the web, I don't know how to tap dance. It's been a very rich day, though, and it's going to be an interesting plane ride home for me, and thinking about what's occurred today and what next steps we might be taking. And I hope that those of us who have a chance to reflect a little bit more will come back with even richer thoughts about how we can move this forward. Drew?
This is from Lucy Johns. I was in the CDC Grant Review Committee in 2009 to review the proposals for community-based and community-driven research. Maybe the staff working on that, maybe contact the staff working on that some years ago for experience with grants that were approved. In regards to academic community research, how did it go?
Thank you for that comment. Good suggestion. Are there others? Okay, that's it. Any other member of the public who'd like to make a comment or reflection in terms of the day, you're welcome to make it at the microphone at this point in time. All right. So once again, it's an opportunity for me to thank all the speakers for taking the time to make their preparations and really help us move our understanding of this issue forward. So thanks to all the speakers. Let's give them a hand. Mary Lou, thank you and your committee for just a terrific job. Alina, the IOM staff, thank you. And thank you all for your, thank you. And thank you everybody who's taken their time to be with us here today. This has been very rich. Thank the members of the roundtable as well for your thoughts and so forth. So are there any announcements that we need to make, Alina? Doesn't look like it. We stand adjourned. Thank you very much.